Hello guys, welcome to my channel. In this video, we are going to see about the hip bone. So first of all, let us see what is a bony pelvis. So the two hip bones along with the sacrum and the coccyx, they form the bony pelvis. On the lateral side of the hip bone, it presents a cavity called the acetabular cavity which articulates with the head of the femur. This hip bone presents three parts. One is the ilium, then this is the ischium, and this is the pubis. So during the early life, these three bones, this ilium, then the ischium and the pubis, they three are separated by a cartilage, by a Y-shaped cartilage. So it lies in the acetabular cavity. So later this cartilage ossifies. So on a whole, this hip bone is an irregular large shaped flat bone. Let us come to the ilium. So this ilium, you can see this is a fan shaped bone and it has two parts. One is the upper part and the other one is the lower part. And it presents three borders. One is the anterior border. This is the anterior border. This is the anterior border of the ilium. And then the posterior border. This is the posterior border. So this is the posterior border of the ilium. And another border is the medial border. This is the medial border of the ilium. So totally the ilium presents three border. One is the anterior border, other one is the medial border, and the other one is the posterior border. Then the ilium presents three surfaces. One is the gluteal surface where the gluteus medius minimus and the maximus gets its origin. Then of course the next surface is the iliac fossa and the next surface is the pelvic surface. This is the pelvic surface of the ilium bone. So totally it presents three surfaces. One is the iliac fossa, the next one is the pelvic surface, and the next one is the gluteal surface. As I already mentioned, this ilium has two ends. One is the upper end, the other one is the lower end. Let us first see about the upper end of the ilium. So this is the upper end of the ilium. This entire portion, this is the upper end of the ilium. So this upper end is otherwise called as the iliac crest. This is called as the iliac crest. As you can see here, this upper end is elongated as well as it is expanded. This is the anterior portion of the iliac crest and this is the posterior portion of the iliac crest. So when you look through the iliac crest from the anterior side, that is the anterior view, you can notice that this iliac crest is concave anteriorly and convex at its posterior part. Here you can see a projection on the iliac crest on the anterior side, and this is called as the anterior superior iliac spine. This portion is called as the anterior superior iliac spine. So this projection on the iliac crest at its anterior end is called the anterior superior iliac spine. And on the posterior side, you can notice a projection called the posterior superior iliac spine on the iliac crest. So the anterior end presents a projection called the anterior superior iliac spine and the posterior end presents a projection called the posterior superior iliac spine. Then this iliac crest, it could be divided into the ventral segment and the posterior segment. This is the anterior segment of the iliac spine and this is the posterior segment of the iliac spine. So as I already mentioned, when looked from the anterior side, the anterior portion of the iliac crest, it is concave, whereas the posterior portion, it is convex. Now coming to the ventral segment of the iliac crest. So this ventral segment, it presents an inner lip, an outer lip and an intermediate portion. So this is the inner lip of the iliac crest and this is the outer lip of the iliac crest and the intermediate portion. This is the intermediate portion of the iliac crest of the anterior segment or ventral segment. This outer lip of the iliac crest, it presents a tubercle. So see, this is the tubercle. This is the iliac tubercle, just 5 cm above the anterior superior iliac spine. That is the outer lip of the iliac crest. It presents a tubercle 5 cm above the anterior superior iliac spine. Now coming to the dorsal segment of the iliac crest. This is the dorsal segment of the iliac crest. So till now we saw about the ventral segment of the iliac crest, that this ventral segment has an inner lip, then intermediate area and an outer lip, and the outer lip presents a tubercle called the iliac tubercle just 5 cm above and behind the anterior superior iliac spine. Now coming to the dorsal segment of the iliac crest. So this dorsal segment, it extends from the junction with the ventral 2/3 of the iliac crest till the posterior superior iliac spine. It extends till the posterior superior iliac spine. So this dorsal segment, it presents an inner surface. So this is the inner surface and also an outer surface. So this is the outer surface of the dorsal segment, which is separated by a ridge in between. This is the ridge. This entire portion is the ridge in between the inner surface and outer surface of the dorsal segment of the iliac crest. So till now we saw about the upper portion, that is the upper end of the ilium. Now we will see about the lower end of the ilium. So this lower end of the ilium, it forms about 2/5 of the acetabulum. So till now we saw about the upper end, lower end. Now we will see about the borders of the ilium. First coming to the anterior border of the ilium. This anterior border of the ilium, it extends from the anterior superior iliac spine to the acetabulum. It extends till the acetabulum. Then another important landmark of this anterior border is the presence of anterior inferior iliac spine. So this is the anterior inferior iliac spine in the anterior border of the ilium. Then coming to the posterior border of the ilium. So this posterior border, it extends from the posterior superior iliac spine and it continues with the posterior border of the ischium. So this posterior border, from above downwards, it presents the following parts. One is the posterior inferior iliac spine, then the greater sciatic notch, then the ischial spine. This is the ischial spine, and then this is the lesser sciatic notch. So once again I am mentioning, from above downwards, this posterior border of the ilium represents the following structures. One is the posterior inferior iliac spine, the other one is the greater sciatic notch, then ischial spine, then this is the lesser sciatic notch. Then coming to the medial border of the ilium. This medial border of the ilium, it extends from the iliac crest till the iliopubic eminence. So this point, this is the iliopubic eminence. So this medial border, it extends from the iliac crest to that of the iliopubic eminence. This medial border of the ilium, it separates the iliac fossa from the sacropelvic surface. And another important thing I would like to mention is the lower part of the medial border, it is smooth and round, and this is also called as the arcuate line. This is also called as the arcuate line. Next, coming to the surfaces of the ilium. As we already saw, this is the iliac fossa, this is the sacropelvic surface, and this is the gluteal surface. First coming to the gluteal surface of the ilium. This gluteal surface, it is convex anteriorly and concave posteriorly. Again I am mentioning, this gluteal surface, it is convex anteriorly and concave posteriorly. This gluteal surface is actually bounded above by the iliac crest. So bounded above by the iliac crest and below by the acetabulum, and anteriorly by the anterior border of the ilium, and posteriorly by the posterior border of the ilium. And of course, behind the acetabulum, it becomes continuous with the posterior border of the ischium. So this is the gluteal surface. This entire portion, This is the gluteal surface. So this gluteal surface becomes continuous with the posterior surface of the ischium behind the acetabulum. This gluteal surface is actually divided into 4 spaces by 3 lines. So the first one is the posterior gluteal line. It actually extends from the iliac crest, outer lip of the iliac crest, till the posterior superior iliac spine. So posterior gluteal line, it extends from the outer lip of the iliac crest to the point in front of the posterior inferior iliac spine. The next one is the anterior gluteal line. It actually extends from the upper border of the greater sciatic notch till the outer lip of the iliac crest. Actually, it becomes continuous with the outer lip of the iliac crest. This anterior gluteal line is the longest line. The next line is the inferior gluteal line, which extends from the anterior inferior iliac spine till the upper border of the greater sciatic notch. Then coming to the next surface, that is the iliac fossa. This surface is actually bounded anteriorly by the anterior border of the ilium, then behind by the medial border of the ilium, and above it is bounded by the iliac crest. Coming to the next surface, that is the sacropelvic surface. Actually, it is located behind the medial border. So this entire portion, this is the sacropelvic surface. It is actually located behind the medial border of the ilium. So this is the sacropelvic surface. It is actually divided into 2 parts in turn. One is the sacral part. This entire portion, this is the sacral part of the sacropelvic surface, and this portion is the pelvic part. This sacral surface, this sacral part of the sacropelvic surface, it actually presents the auricular surface. This is the auricular surface anteriorly and a iliac tuberosity posteriorly. This roughest part, this is the iliac tuberosity. So this sacral part of the sacropelvic surface, it actually presents an auricular surface anteriorly and an iliac tuberosity posteriorly. This auricular part of the sacral surface, it actually articulates with the sacral bone. This articulates with the sacral bone, the articular surface of the sacral bone. And coming to the iliac tuberosity, this is nothing but a roughest portion below the iliac crest. Then coming to the pelvic portion of the sacropelvic surface, actually it lies below the auricular surface. As I already mentioned, this auricular surface is nothing but which articulates with the sacrum, the auricular surface of the sacrum. So this pelvic portion, which is lying just below the auricular surface of the sacral surface, it actually continues with the pelvic surface of the ischium. This pelvic surface of the ilium continues with the pelvic surface of the ischium. This sacropelvic surface presents a sulcus called as the preauricular sulcus, which lies just anterior to the auricular surface of the sacropelvic surface.